Good morning, everyone, and welcome to Face the State. I'm Mike Dennison, MTN's Chief Political Reporter. Today on Face the State, we'll be talking about one of the biggest issues before the 2015 legislature this year, and that's Medicaid expansion. Expanding Medicaid will expand medical coverage to thousands of low-income Montanans. It will also bring millions of dollars into the state from the federal government, and the state will pay some of the share of the cost as well. But before that happens, the program has to clear some hurdles. It has to get approval from the federal government. It also has to be implemented. It's a fairly complex program. The state, along with a private contractor, will be doing the implementation next year. To talk about some of those hurdles and the way the program is going to go, this morning I have with me Senator Ed Buttrey from Great Falls, a Republican who was the chief sponsor of the Medicaid expansion bill, and also Tara Veazey, who's the chief health policy advisor for Democratic Governor Steve Bullock, who also supported the Medicaid expansion. Tara, we'll start with you. Let's talk about the federal process. You've submitted a request to the federal government to get approval for our program. What's going to happen now? How soon will it happen? And what things you're expecting in that process?
Well, thanks, Mike, for having us here today. The federal government, the quickest they can act on a waiver is 45 days. There is a mandatory 30-day public comment period and then a 15-day waiting period on the federal side before approval can happen. So on the state side, Governor Bullock asked his team to work as quickly as possible to get the waiver submitted to the feds by September 15th. That would allow CMS to approve the waiver as early as November 1st. Now, the reason that November 1st deadline is so important is that that's when open enrollment begins for the private marketplace exchange. And what we want to make sure we're doing is doing everything that's possible and in our control to make sure that when people go online to see what coverage options are available to them, they can also find out at the same time if they're eligible for the HELP program or not. Now, there are a lot of things motivating the quick time frame on the state side. One is to get people that information during open enrollment, and then the other is, when you've worked as long on an issue as Governor Bullock has or Senator Buttrey has, you can really see the faces of the people who are waiting to get this coverage, to get these services, whether it's the father with 3 daughters in Kalispell who has a bad heart and is waiting to get on the transplant list because he can't get on now because he doesn't have health care coverage, or whether it's the doctors and the nurses and the business leaders who are worried about the viability of their clinics and hospitals, which in turn affects the viability and health of our communities all across the state. So we're highly motivated to get it done. The tricky part is we don't control the federal timeline. So we know the earliest they can approve is 45 days, which would put us at November 1st. But they aren't obligated to move that quickly. I will say that Governor Bullock has talked to Secretary Burwell and expressed how important timeliness is here, and I think all of the parties are working really hard to try to get something done as quickly as possible.
Now, Senator Buttrey, I know that you spent some time talking to the feds as well as you developed this program, and they have raised some concerns about it. They've talked about the premiums that will be charged to Montanans, which is fairly unique in the country, and also about some of the co-payments. I'm just wondering, how confident are you that the federal government is going to give its stamp of approval to the program? And if there is a problem and they say we don't like this or that, what happens then?
Yeah, thanks, Mike. That's a great question. That's really what it comes down to now. Is it's an issue of, is it more important that we're going to talk about premiums and copays for the folks at the lower end of the income spectrum, which is really what the big issue is. The law was written in such a way as that we wanted to maximize the investment of all parties that are participating in the plan. And that meant premiums and copays for anyone that was participating. In the law, we wrote it as such that it would be to the maximum amount allowed by federal law. The arguments and discussions going on now between the state of Montana and the federal government is, what are those limits? What is the maximum amounts allowable under federal law? And that's what's ultimately going to make that decision. Personally, for me, I think it comes down to, does the federal government feel that it's important that we get these folks coverage, or do they feel it's more important that we make a statement that we can't charge folks any part of their health care? We wrote the law with pretty tight sideboards on it. Again, it is under the determination as to what's allowed by federal law. When the feds come back and they've made a determination and the state looks at that, if there are changes that go above and beyond what's allowable by the federal law, then that could involve up to even legislative action, where nothing could happen until the next legislative session, or that the legislature would have to address that between now and then.
Let's talk about we'll come back to the premiums in a little bit, as far as how much they are and other things about eligibility. But let's assume that the feds do approve this sometime in the next several months, and we're aiming for a launch sometime early next year, perhaps as early as January. How do people sign up? How do we determine who's eligible? How is that process going to work?
Well, there are a couple of pieces to the outreach and enrollment, and we'll be working with a lot of partners to make sure that enrollment happens as effectively and efficiently as possible. So a couple of examples. If you think of enrollment as sort of having two primary strategies. One will be really primarily the responsibility of the state and the Department of Health and Human Services. And what they will do is look at their broad array of records of who is currently accessing benefits within the department and make a determination of who they think might be eligible under this expanded help program, and who they actually know is eligible based on the information we have. And we'll do direct outreach to those folks to let them know how they can enroll.
So they'll be notified by the state?
They will be notified, and the easiest way to go ahead and get enrolled and make sure that they're eligible. The other piece of the puzzle will be working with the broad array of partners that we've been working with for 2.5 years to actually get the HELP Act passed and get some form of expansion passed. So that's everyone from hospitals to community health clinics to navigators and certified application counselors to tribal health clinics, all of whom, to low-income advocates and AARP, all of whom have been really highly motivated to get something passed and have stayed just as involved and active to make sure that the actual enrollment and implementation is a success. So we'll be working with those stakeholders and those providers to make sure that they have all of the training and information and capacity that they need to get people enrolled when they come into contact with them.
Okay, now Senator Buttrey, as you know, critics of this program said, well, this is just another welfare program we're starting up. I don't think you believe that that's what it is. What's your answer to that criticism, and is this just another welfare program? How would you describe the program? Who is it supposed to help and how?
Well, I think I'd answer that in two ways. One of them is that the ultimate entitlement program exists today. The same folks that would be affected by the HELP Act are getting free health care today. They're just simply getting it at the wrong time, at the wrong place, and in the most expensive manner possible. They're getting it in the ERs, which is going to be 5 times or more the cost of if they went in the front door of the hospital. They're not getting preventative care, which then you can avoid a lot of the chronic conditions and the cost to themselves and to all of us later on in life. So I think that my first response is that, if we want to address entitlements, that's what the HELP Act is doing. We're addressing the entitlement today, which is free health care. The second way I would address it is that, if we look at how much we're dependent on the federal government, we're a large state, one of the largest states, we have one of the smallest populations, and we have one of the highest populations living in poverty. I think today we're 48th in the nation in take-home pay. If we want to address how much money we're taking the federal government, address these entitlements, we have to do something about it. Simply complaining about the problem is not enough. We can't change our state size. We can't drastically change our population, but one of the things that we can do is we can aggressively attack this issue of poverty. And that's what the HELP Act does. Through its economic development program, through mating that with health care, ultimately someone cannot keep and hold the job and be successful in a job if they're not healthy, if they're on addictions, if they're not being treated for mental illness. So we do those things. We take them out of poverty, we take them off social programs, and ultimately we reduce their dependence and our state's dependence on the federal government.
Thank you. And I think we'll come back and talk a little more about the economic part of the program later in the show. Let's also talk a little bit about who is eligible. How much money can you make and still be eligible? How much is the premium? And then also there is an asset fee or test. Let's talk about that as far as who can get the program and maybe who cannot.
So in order to talk about who the HELP Act will cover it's good to provide background on who is currently covered under Medicaid. And it's important for folks to know that right now our eligibility standards are very, very low in Montana. So for most people without kids, you have to be sick, blind, or disabled to qualify for health care now. So going back to Senator Buttry's point, you're really waiting till people who are so sick and have had their conditions untreated for so long many times that they can no longer work. And it's only then that they cannot get access to health care. For parents of kids that make under 50% of the federal poverty level, which is about a little under $6,000 a year, they also get covered right now. But as soon as they make 51% of the federal poverty level, they're no longer covered. So there's interesting incentives in the program right now. What the expansion will do under the HELP Act is allow everyone who's under 138% of the federal poverty level to qualify. Now, I might not get the number exactly right here, but I think it's somewhere between $16,000 and $17,000 a year for a single person.
$16,400, I believe, for a single person.
I told you before the interview that you didn't need us here.
And Mike, if you look at and that's for an individual,
right,
you're talking about someone becoming ineligible for the HELP Act at roughly $7.78 an hour, which of course is under minimum wage.
Yes.
So the premiums under the HELP Act are set at 2% of income, and for someone making 50% of the federal poverty level, which I most recently looked at, I believe that's around $10 a month that they would be paying in to get access to the healthcare services provided.
Also, the asset test, it's not called an asset test, but my understanding of that is that you can have a house up to $250,000 of value, you can have $50,000 in assets, and you can have a vehicle. And if you're above that, then you have to pay a fee in order to be covered by this program. Now, I looked at those requirements, and it looks to me like you're essentially trying to discourage people with those sort of assets from being on the program. Is that correct?
Well, I'll start out answering that. There is no asset test in the bill. There's what we call a taxpayer integrity fee, which is worked through the Department of Revenue, and it, as you said, looks at the home, looks at the value of vehicles and other things that someone may have, and basically we don't want to take anyone or not include anyone from the program, but if you exceed those limits, then we feel that you ought to pay more into the program to be part of the program.
I think it's a really important point that there is that fee is not in any way associated with enrollment or services. So it's really saying for those people who have the means to pay more and to help share in the cost of providing healthcare services, that we're going to ask a little more of you.
And how are we going to enforce that provision? Who's going to be checking to see if someone has 5 cars or has an additional house or has $100,000?
As Senator Buttry said, that'll be a responsibility of the Department of Revenue.
Okay. Also, as far as the number of people who are going to be covered by this program, we've heard a lot of numbers thrown about. During the session, I think we said anywhere from 23,000 to 30,000 in the first 2 years. Those are the estimates. The latest numbers I've seen from the bidders on the management contract, I believe it was 18,500 the first year, and maybe 23,000 the next year. What do you think those numbers are going to be? And in other states, almost all the time we've seen it far exceed the initial estimates. And what are your expectations?
Well, a couple of comments. One is that the estimates were done by the best number crunchers we have at the Department of Health and Human Services, and they're based really on 3 separate factors, so it can get a little bit confusing. One is the total number of people eligible, and that's fairly easy to come up with. You go to the census and look how many people are under 138% of the federal poverty level, and you know who are eligible. The 2 remaining factors are called take up and phase in, and what that refers to really is how many people, what percentage of the people who are eligible are actually going to sign up, and how long will it take them to sign up. So if you go back and look at the Healthy Montana Kids program when that was passed by initiative, it took a handful of years to really get up to full enrollment where we expected it. It takes a while for people to find out about the program, to decide whether it's something they want to do and to sign up for it. So in the end, they're estimates. They're based on the best information and history of program usage that the department could find, but they are estimates. In terms of, you're right that in many of the states that have expanded, the estimates have been exceeded, that there are a lot of people out there who've been waiting for health care coverage and who really need it to lead healthy and productive lives. I think at least from our perspective, from Governor Bullock's perspective, the more people we can get enrolled, the better. It's not just more people getting access to the health care they need to be productive members of their community and their workforce and their families, but it's also additional of our federal taxpayer dollars coming back home to help pay for it and help invigorate our communities. So we think the estimates are good, but if we exceed them, I think we'll celebrate that.
And Mike, in the first fiscal year, the fiscal note on the bill estimated, I think, around 26,000 people signing up, and at the end of the 4 fiscal years, about 45,000. You know, we have a smaller population in a lot of states that would be eligible, so I would think our deviation is going to be a little smaller than what you've seen in some of the larger states. But what's important is the HELP Act included the creation of an oversight committee, because we knew that a lot of what we were doing was we're estimating, especially when it came to the number of folks that would sign up for as participants in the Act. So we're going to track those numbers, and we're going to track a lot of data. We're going to report that data back to the executive. We're going to report it back to the future legislatures so that we can make any needed changes, so that we have real numbers at hand and we can make good decisions.
Of course, the amount of people that are covered is going to dictate somewhat how much money is coming into the state from the federal government and the cost of the state. I was wondering, Senator Buttery, you're a businessman, and you look at that money coming into the state. How do you evaluate the economic impact of that? Because the proponents have talked about it being a huge impact. Some of the detractors have said that that's overblown. What's your evaluation of the impact of this, probably hundreds of millions of federal dollars coming into the state?
Sure. First of all, Mike, I would mention that we've been paying heavily into this system for a number of years. And there's a lot of numbers that we can throw out there and it's many, many, many millions of dollars and many hundreds of thousands of dollars that leave this state each and every day that go into the ACA. So you can look at it and say we're bringing federal money back. I think we're bringing money that Montanans paid into the system back into Montana. When we look at the economic impact, we've got to look at both sides of the P&L. We're going to have expenses that are going to be determined by the number of participants in the plan. And in many states, as we've discussed, the participants have been higher, and so you have groups that talk about how the expenses were so much higher than planned. But you have to look at the other side, on the revenue side. And we don't have, even when you look at the positive impacts listed in the fiscal note, what the fiscal note doesn't account for is the jobs created, is the income tax that comes into the state of Montana from those jobs created, whether it's payroll tax, whether it's corporate tax, whether it's folks paying property taxes because they've been able to go out and buy their first home. We have to look at the impact on the reduction in use of social programs. So when we look at all of those, and we're seeing data now from other states like Ohio and Kentucky, we're seeing nonpartisan reports from companies such as Deloitte, where they're actually looking at the jobs created, the tax impact, what it's doing to states' budgets, and if the program can and will pay for itself. And that's what we'll do with the Oversight Committee. So I think that we have to find a way to track everything that's happened as a result of the Act, not only the expense side, but very importantly the revenue side, and find out what the true impact is to our state budget, to the folks that have and are paying for insurance now, and to the average taxpayer. And that's what we'll do with the Oversight Committee.
I think if I can just add, I think
Sure.
Senator Buttery made a really good point. He doesn't like it when I tell him he made a good point, but that what we're seeing in other states is that even where enrollment exceeded expectations, they're also finding that the savings to the state have also exceeded expectations. So I think
And that's my point, is
Yeah.
we have to look at the whole picture. You can't pick a data point in time, and we see that happen from both groups from groups on all sides, is they'll pick a point in time and say, well, your enrollment was higher, so your expenses are out of control. But what you have to look at is the revenue. Is the state managing that enrollment? Are we putting people to work? Are we creating the right types of jobs? And are we bringing income back into that state to pay for the program? And that's what we need to make sure happens. I believe that the HELP Act will create a lot of jobs, is going to pull a lot of people out of poverty. We're one of the first states, and certainly the state most focused on bringing together economic development and healthcare, and understanding that you have to bring them together for people to be successful, and I think the program will be successful.
Now, another economic aspect that we haven't talked about much is the kind of the job training and job evaluation provisions in the law. I looked at those. It looks like this is an attempt to take people who may have lower paying jobs and perhaps train and direct them toward better paying jobs and lift them out of poverty. But it is voluntary. I'm just wondering, how is that going to work, and how much do you think people will actually take the state up on those offers?
Sure, it is voluntary. Initially, when I drafted the bill, it was a mandatory requirement to take part in the program. That's a work requirement, and the feds would not allow that. But the Department of Labor is creating what I think is the most targeted and focused economic development program in the state's history. And that was important to me when I wrote the bill. To me, this is an economic development program that realizes people have to be healthy, off addictions, and mentally healthy to work and succeed in jobs. So what the Department of Labor will do is they will hold classes, and there'll be around 400 initial classes around the state, to talk to folks that are signing up for the HELP Act program. Those classes will be of two different flavors. One will be for folks that are trying to find employment, and another type of the class will be for folks that have employment but that are trying to achieve better employment. And in those classes, they'll assess people, and they'll try to identify barriers either to employment or better employment, and they'll follow up. They'll set a schedule to follow up with folks to figure out which program, which way we as a state can best help these people maximize their opportunities and goals in the workplace. And so we're going to physically touch every one of those folks. The fiscal note estimates that 80% of the people that are involved in those initial classes will take advantage of the state's programs. And the programs don't mean necessarily that we're sending someone to college or sending someone to a trade school. It means we're identifying barriers. It may mean that we're simply teaching them and helping them write a better resume. It may mean that we're helping them understand the dynamics of a job interview and perform better in job interviews. It just is going to be whatever is keeping them either from that initial job or the better employment. Touching these folks, helping them out, helping identify those problems, and providing assets, providing help that we have, and most of that help is in existing programs within the state. If we can do that and get folks successful, get them out of poverty, get them onto the exchange and beyond, teach them healthy behaviors, teach them how to pay for their own health care, then I think the state has taken a great step forward.
And this is one of those provisions that Governor Bullock was really excited to support, that Senator Buttry had. I think both Governor Bullock and Commissioner Busey are really excited about the possibilities that are opened up with this provision for the people that really want to make a better life for themselves and their families. And the governor, as he traveled around the state talking about this issue and talking about Senate Bill 405, the HELP Act, heard from people who would be eligible for health care who really were just as excited about these job services programs. And these are folks that, yes, they want to live a healthy life and have access to health care that you and I do when we get sick or when we need to treat a condition or try to prevent future illnesses. But there are also people who are looking to better their lives and better the lives of their children. And so I think there's a lot of exciting opportunity here. Commissioner Busey is working hard with her staff to make sure that they're coming up with a program that really can be tailored to the individual needs of the participants that they see. I would love to talk about just one particular program that they're working on because I think it's really interesting and really exciting, and that is they have another grant that they're working on that's implementing something called the Healthcare Montana program, and it's to help low-wage workers or displaced workers get into high-demand, high-paying healthcare jobs. We know that as our economy ages and grows, that's going to be a growing segment of our economy. And so what they're doing is looking at reducing those barriers and getting people into programs that can move them into the healthcare industry, whether it's recording jobs or APRNs. So they're working with community colleges and tribal colleges all across the state, and we'll be looking at ways to get HELP Act participants into that exciting program as well.
And Mike, I think it's key that we need to recognize that we don't succeed by just providing health care. We don't succeed by just providing economic development opportunities. That's one of the problems that I've always had with the Affordable Care Act as written, is it's all about health care. I think if we're going to succeed with this plan and Montana's the first state to do it, is we have to have components of both and we have to work together. We're working together with the state, and to the governor's credit and Commissioner Busey's credit, they've really grabbed onto this idea of pulling people out of poverty at the same point that we're ensuring that they're healthy. Senator Mary Cafaro out of Helena and I are working hand in hand with Department of Labor to do whatever we can from a legislative side to help implement these programs and to make sure they're the right programs. Ultimately, the HELP Act is going to create a lot of jobs in healthcare and ancillary industries. Why not utilize those newly created jobs as much as possible for this population, put them into these jobs, get them out of poverty, and move forward?
And you mentioned the healthcare. I mean, there's certainly demand for those types of positions all across the state, and will be a continued demand.
Absolutely.
We still have a couple minutes left here. One thing I want to touch on briefly, and that is mental health. We haven't talked much about that. Of course, there was lots of discussion during the session about the mental health crisis in Montana, and having services locally, and having the state hospital full, and wanting to develop more of those local services. How is Medicaid expansion going to affect the availability of those local mental health services, if it will at all?
So Mike, I think it's a really critical question, and one that we're probably not talking quite enough about. There are thousands of Montanans suffering with mental illness, and just about everyone we talk to has a neighbor or a friend or a family member who's suffering and is having trouble getting the care that they need. I think there were a lot of good mental health bills passed in the 2015 legislature that are going to help bolster our continuum of care, including community-based services. I think that personally the most important piece of mental health legislation to pass was Senate Bill 405, the HELP Act. And that is, it provides basic health care coverage, including mental health, for every person who is eligible. And that means they don't have to access one particular community program. They have the full access of mental health services that's afforded to you or I or anyone else who has private insurance. And I think it's really hard to underestimate. It would be hard to overestimate just what a huge impact that will have in the lives of people who really want to get treated early on when they're struggling with a mental health issue. Get in and get that care early on so that they can avoid crisis down the road. I think it's one of the most critical and important pieces and effects that we're going to see from the passage of the HELP Act.
And certainly treat the mental illness while it is treatable. Yep. Because once it becomes untreatable, it does become a great cost burden to the patient, to their families, and to the state.
Yes. Yeah. Well, thank you, both of you. I think we're probably going to have to wrap up this week's edition of Face the State. I've been talking to Senator Ed Buttrey from Great Falls, and Tara Veazey, the Chief Health Policy Advisor for Governor Steve Bullock, about Medicaid expansion, which is coming down the pike this year and next. Thank you for joining us this morning on Face the State. I'm Mike Dennison, Chief Political Reporter for MTN News.
You've been watching Face the State, a presentation of MTN, the Montana Television Network.